Hey guys, sorry about the difficulties. Uh, uh, Let me add my guest, Devika. She is psychologist, and we are going to learn about psychology and how mental health with her. So let me go ahead and add her. Hey Devika, I have sent
Okay.
you the request. Hey,
Hi.
hi, how are you?
Good. How are you?
I'm good.
Can you see me okay? I've never done an Instagram live. Do I am I
Yeah, yeah, I can see you perfectly fine.
good? Thank you so much for, for all of the messages and having me on today.
Yeah, we are so excited. Due to pandemic, you can see a lot of mental health issues as well, and we really wanted to have you and let our viewers know like what they can do, how things feel, and everything. Yeah.
Yeah.
Yeah. So before we start with other topics, let our viewers know about yourself and how you get into this field.
Yeah, of course. So, my name is Dr. Devika-srivastava. I'm a licensed psychologist in Houston. I practice in I got into this field because I wanted to help people. I was pre-med in college, but my mom is a psychologist and mental health just seemed much more important, all of the different factors because it's not just physical health. It has to do with your family, it has to do with your identity, things like that. So, that's originally why I went into it. And then my journey has been, very long. I don't know if you want me to give a little bit of about me, about my bio or
Yeah,
not, or
yeah,
okay.
obviously.
So, I went to school in New York. I went to Columbia. I went to Fordham for my doctorate. I have worked in hospitals, community centers, college counseling campuses, um, the VA for a long time, working with veterans as well with pain and medical issues. And I've also lobbied in Capitol Hill, working on mental health policy for people of color, including South Asian Americans, refugees, immigrants, students, people with disabilities, HIV, veterans. A lot of my work has actually been lobbying mental health policy federally, state, and city. Um, I worked in our county mental health services, developing programs and making sure that they're running correctly and doing policy work to get funding,
Mhm.
and to make sure that they're effective. One of my last jobs, I was a psychiatry professor, supervising postdoc fellows, overseeing medical students, psychiatry residents, teaching them about social equity and how to work with people of color. And I covered a whole public hospital. So all of the medical units, ER, SICU, everything, providing crisis care, people that had medical issues, depression, anxiety, mood disorders, psychotic disorders. And now I have a private practice and I work primarily with South Asian Americans, second gens, first gens, third gens, second generation, people of color, women, just a variety of different people with different issues. I'm also one of the editors on the first ever book on South Asian American psychology. So that's really exciting. And for those of you that are mental health professionals, or want to know more, I'm also past chair of the Division on South Asian Americans, which is a division under the Asian American Psychological Association. And it's a giant community of mental health providers and students, doing research and providing clinical work, and anyone interested in mental health for South Asian American populations. So that's a really good community to be part of too.
Wow. Yeah. So, like, as you worked in so many places and with different kind of peoples,
Mhm.
so how you think, like, with normal policy and mental policy is different? Like,
Well, it is and it isn't. So, it's like help. And so, I worked. in health policy. So I worked on the Healthcare Reform Act, like the Obamacare bill and things like that. So all of these health bills, healthcare reform bills, and mental health policy is basically a policy that has to do with providing mental health care, funding for mental health care, funding towards different programs. So, for South Asian communities, or, you know, people that have depression, people that have schizophrenia, or, when you add in culture, maybe children that, are preschool age that are dealing with ADHD. So all of those things in terms of programming have to do with policy, and funding towards that policy and training, because you want mental health providers to have training to work with those populations. But part of it is that it has to come from policy. Like, these are important populations, like for our people, for South Asian populations. I do a lot of research, in my policy work, saying, what are we going through? What are things that are coming up for our communities that are important? And why is training important for people that are working with our population? But also, what works for our population? Because things that might work for other people, given our culture, given our families, given our identity, might not work. And even the way that we express different symptoms might be different. So having people that can catch that and work with us in a way that's effective and culturally competent is important.
Oh, okay.
Yeah.
Yeah. So, as you have worked with a lot of different generation, what are the common problems you find in first generation?
So, I don't want to say,
Can you just
oh,
tell a little?
yeah, is this good? I'm sorry, I'm on my phone. Is this better?
No, little tilt on your top. We cannot see your face clear. Yeah, that's
Oh,
perfect.
okay, good.
Yeah.
Okay. So for a lot of first gens, which we consider our, that have come to this country. So if you're an immigrant, um, like a lot of our parents, or, sometimes even our grandparents, what is hard is that you have, all of us, even second and third, we go through a process called acculturation, meaning how do you adjust to this new country that has different values, different cultures? It might be language also. You have to learn a new language, some of us, or just new customs, and how to navigate, in your new environment. That can be really hard. And so a lot of times, first gens, that's what they go through, right? How do I adjust to where I'm at now without family, without the social support, without the things that I know and the language that I speak? And so a lot of times it's that, how, and if they're coming with, a lot of times it used to be, the husband and the wife, they come and then they have the kids, but it could be bigger family systems. And how do they now adjust and call this home? That can be difficult. And how do they manage stress? Because where they see. So for us, a big part of it is community. Your neighbor, everybody. You have a big community of people. And sometimes when you immigrate, you don't have that anymore. So
Yeah.
how do you develop it, or how do you now have to cope with things in a different way? And that can be really difficult.
Okay. So, the childrens who born here, right? So they feel their South Asian culture at home, and they go to school, right? That's totally different culture.
Yeah.
So, like, do you see they have a trouble, coping up with two cultures, and do you see them getting in depression? Like, have you experienced those kind of clients?
Yeah, I mean, I think a lot of us ourselves are second gen. So second gens, a lot of times people say second or 1.5 is if you've come before the age of 18 or were born here. And the what you're talking about, the difficulty is again kind of acculturation. You're raised here, which is different from maybe your family in South Asia or India, right? Where the values are different, the way of life is different, how they navigate life, and their experiences might look very different. Where if you're born here, you have a mix of oftentimes independent values, right? Like those Western values of independence or self-reliance, or, at the age of 18, you go out of the house. But if you're South Asian, our collectivistic values are family. And, a big part of how we see ourselves is through our family, one of the biggest sources of conflict is actually relationships and dating, and also career choice. Your parents might want you to do something, in terms of being a doctor or doing something, but that's not what you want to do. And so a lot of conflict happens. Um, but also what they want from themselves, how they live their lives might be different. And sometimes what causes a problem for my clients, and just in general for people kind of that are second generation, is you have to pick and choose in a way those collectivistics or those independent values for what resonates with you in terms of, what are your values given your bicultural identity? How do you want to live your life? What's important to you given your experiences? And that can be hard to navigate because you might not have a lot of other friends that are South Asian or second generation, and you might feel really isolated and alone. Your family is different, like something that I find my clients saying. And, for me, it's like, oh, well, I couldn't do sleepovers. I didn't do, I couldn't, I didn't date. I couldn't tell my parents that I was dating, because our culture is different,
Yeah.
where it might be open here, but for us, you don't do that.
That's true.
And so, conflict, anxiety, isolation, all of those things can emerge. Um, and sometimes you take on other values like your friends that might not be South Asian, but then later on you're like, you know what, my Indian culture, my Indian American culture is important. And then you revisit that and what's important to you later on, maybe in college or as an adult. So it's a really interesting process.
Yeah, that's true. So like before we go ahead question, I got one of the
Yeah,
comments, so I just want to talk with that. So
yeah.
Suzanne is commenting, Latino culture too has a lot of issues with the mental health, such as not getting help, huge ignorance, and they think it's strange to get mental health therapy. So have you experienced because you live in community, so some parents think that getting mental health therapy is strange or they are not
Mhm.
comfortable with it? Have you experienced that?
Yeah, I mean, and that's a huge issue, not just in South Asian American communities, like Susan is saying, it's also in any collectivistic cultures. It could be Latinx, it could be African, it could be, other Asian American groups. There's a lot of stigma, right? Like if you have anxiety or depression or, even, schizophrenia or something that's challenging, there must be something wrong with you, and you don't tell anyone, right? A
Yeah.
lot of it is, if I share something, people are going to think that there's something wrong with me, and they might, not talk to me anymore, or might gossip about me. So, the thing is, fortunately, even in those countries, it's changing. But here, you know I'm part of, DOSA, and I'm a South Asian American provider, but a lot of my clients are people of color, including Latino clients, Latino American clients. And part of it is to reduce the stigma. It's okay to have these challenging issues. And, you know, if you do have depressive symptoms or anxiety symptoms, normalizing that. It's good to reach out. It's good to have these conversations, because otherwise, if you're not getting treatment, if you're not getting help, you'll get worse, you know, and and I think part of it is reaching out into the communities and saying, this is okay. It's not bad to get treatment. And all of us, as human beings, have moments that are difficult, that are stressful, that are sad. And sometimes we need support. And especially if we're in America and maybe second gen or first gen, where we don't have the big communities, we need additional support, just like we would. The thing is, what you're bringing is a very good point, because a lot of times, instead of getting mental health treatment, what happens is we go to our communities, right? And we go to other aunties, we go to other friends, we go to family members, but they can only do so much, especially given your symptoms. And so that's why it's important to have these conversations, work with, your churches, your temples, your gurdwaras, and say, these are the things that might happen. And if it gets bad, if it gets challenging, there is something you can do to get better.
Mm-hmm. Yeah, that's true. So, as you said, right, having going to the friends, family that can help you. So, what do you think? Like, how important family's role when a member suffering with depression or
Hmm.
anxiety?
It's really important. And I actually do family therapy. I do individual, couple, and family. And especially for my collectivistic communities, you know, like Latinx or South Asian, it's a system, right? We're not by ourselves. It's a family system that we're in. Often we live with our families, right? So sometimes they're the ones that see it first, right? Like if you're isolating or if you're feeling sad or if there's changes in eating, but they're the ones that want to help you. And sometimes they can encourage you, but also sometimes if you're having depression or anxiety, they might not know how bad it can be or what your thoughts are like. But part of it is informing the whole system, working with the whole system and supporting them. What do you need? You know, your mother and your father or other family members might not know what can help you. So it is working with everyone together for the whole system to improve, because if you're happy, your family is going to be happy and healthy.
Yeah, true. So, like, here we are talking about one culture, right? But
Mm-hmm.
what if the children who have, interrational parents, like both are from
Mm-hmm.
different
Mm-hmm.
community, then what kind of difficulties you see in them?
Well, I have a number of, I have a number of biracial and multiracial individuals, and it's interesting that you're bringing that up. And I think it's important given how diverse our communities are.
Yeah.
You know, the thing is, it depends on what issues they're experiencing from that. Sometimes it might be, like I mentioned before, different cultural values that they're having to negotiate. Like maybe their mother or father want them to get married at a certain age, because of their cultural expectations. And so it is kind of looking at the individual and seeing, what do you want? Or maybe how do you communicate with your parents about these things? But also in terms of identity issues, that's the thing too, which you're asking, how do they identify with their identity? How do they see themselves? How do they see their families? And is there any kind of difficulty there in exploring that and working on it? Um, and also a big part of it is how society sees them. Sometimes given our society, we're dealing with discrimination or racism or injustice. And so, helping them navigate through that, providing support, but also how they can express their frustration or their anger and what to do with that instead of it building on themselves or feeling isolated from one community, maybe one that their parents is in, and maybe not another, like if they don't look like one parent but they look like another parent,
Yeah.
how they can navigate that for themselves and reach peace and make meaning about who they are.
Okay.
Yeah,
So,
I know
like,
that's long. I have I have
no, but
highlights.
it's really good because you are seeing the other side. Because if I am suffering from depression, that I might don't know that how I am feeling, but as a
Mm-hmm.
therapist, you can help clients to just
Yeah.
open up and find out what are the reasons,
Mm-hmm.
and that's really interesting.
Yeah, and also informing, a big thing is, like when you mentioned family, part of it is having these conversations of what are depressive symptoms, when you are a certain culture. Sometimes, for us as being South Asian, it might be that we're not saying, oh, I'm sad. It could be that we have stomach pain or that we're not eating or sleeping or having headaches. So part of it is informing the family or the individual, what does that look like? What's happening to you when you're feeling depressed or anxious, and working on that.
Yeah. So, like, generally, South Asian, I'm sure in other communities also that will be the same. Like, parents have a path for their kids. They
Mm-hmm.
want
Mm-hmm.
to finish your study at certain age and get
Yeah.
married at certain age. So, do you feel like they follow like their kid follow that same path, and
Yeah.
after getting married, after having children, they feel depressed, like
Mm-hmm.
they are missing something.
Mm-hmm.
Have what is your experience with?
Well, so that's common for a lot of people, even if it's not South Asian. Especially for people that, like if you're a parent and your whole life has been dedicated to your children, right? Like you focus, maybe you left your job and you're a stay-at-home mom, and now that your kids are getting more independent and don't need you as much in the same way, you don't know who you are anymore. How do you define your identity? And that can be extremely relevant when it comes to collectivistic culture. So South Asian and, Latinx and all, a lot of people that are non-white, or maybe even Greek too. But it is part of what do you do then, right? How do you define yourself? Sometimes, you know, you that's the difficulty too that I'm seeing with a lot of second gens, and even just seeing the South Asian people generationally it getting longer. The kids are in college and the mother doesn't know what she's going to do anymore. So she might get depressed, like you're saying, or anxious, but it is really then, how does she connect with community? How does she get support? How does she continue to live? Where she's not waiting until the kids just come home and visit and she's just cooking and cleaning. But how does she have to grow herself now? Maybe with her, her husband or her partner, but who is she now? So going back to work, engaging in hobbies. A lot of women that are South Asian, become more religious, but it is really then you have this new transition in life, and how are you going to develop it rather than just sitting? Because, in our communities, we often live together, right? So the kids don't leave. And if they leave, they come back, they have children, and then you're raising their children. But that's very different when you're here in America, or in another country. So it's really important. How then does the woman or the parent gain meaning in their life?
Yeah.
And it might be reaching out to other people. That's the thing too. If they don't have that community, how do they still become friends with people? How do they connect? Volunteer work, hobbies, going back to school, going back to work. All of these things can be important.
Yeah. So as you mentioned, right, making friends.
Mm-hmm.
So yeah, if you are living from long time over here, then you might have friends. But
Yeah.
like now, a lot of husband and wife, like a lot of couples coming for work, right? And
Yeah.
it's totally new for especially wives because they stay
Yeah.
at home. So what do you suggest them how they can engage themselves and make new friends, like any other
Yeah.
platforms to help them?
Well, I have to say it kind of depends on who they are, right? And it depends on where they're moving to. So I live in Houston, Texas. So it's a very diverse city. It's the most diverse city, but it's also the second largest for South Asian population. So we have different communities of South Indians, Punjabis, Gujaratis. So sometimes it's easier than other places to just kind of go back into those ethnic circles if you want. Sometimes it might be that you're in a much more diverse area and you want more friends. So it is, again, kind of what are your hobbies? What are your interests? Like if you like gardening, joining a gardening club, or if you are religious, joining the temple around you. But also maybe being creative too. Now everything is virtual,
Yeah.
so and you can find different groups online. So it doesn't have to even be in person, especially now during the pandemic, or you can still connect, with, oh, let me see what are the events in my area, and starting to go and talk. The thing is, you're probably not alone. Even for people that have been here for a long time, they were new at one time too. So,
Yeah.
it is understanding that at one time, most people were new, or even if they're not South
Mhm.
Asian, people want to connect. People know what a new setting is like and will be engaging. But you have to try. Don't be scared. I know for my mom, when she came, we didn't have any family here.
Mhm.
So, she just had to she went to the library, she volunteered, she did all of these things and made friends, and she continues to. But, it is just trying to be comfortable and, be creative, and don't be anxious. Sometimes you'll make friends and sometimes you won't, but there are people there if you want. So
Yeah.
I think it's remembering that.
Yeah, that's true. I can totally relate with your mom because I came like 8 years ago.
Yeah.
Yeah, and it was totally new, but I was excited. But staying at home whole day sometimes
Yeah.
just drive you crazy.
Yeah, and it can make you really depressed and
Yeah.
homesick. It's like, oh, where is my family? All my friends are gone. It can take a mental health toll on you. It's a big adjustment. And especially, if you don't know English, or if it's so different from what you're used to,
Yeah, that's
you
true.
know?
True.
So it might be finding the communities or maybe learning the language, but also just doing things that you liked even before you came,
Yeah, that's true.
And remember to still talk to family. It's so easy now to just video chat. Keep those connections open.
Yeah, so as you mentioned, how important is social media? Like, I would say pros and cons, because I know many people get depression
Yeah.
exploring social media, and many people feel connected. So,
Yeah.
what is your experience?
Well, it depends on what the content is and why. Like for some people, they're on social media just to waste time, right? And then they're not being productive, they're not taking care of their responsibilities, they're just online as a form of maybe anxiety, or depression. But it might be the news. There's a lot going on in our world, especially right now. You and I are both South Asian. India right now is COVID is ravaging our communities, and that can be really difficult to hear and see day in and day out with all of the news stories. So I think part of, when you're talking about social media, what is the line between being informed and what is the line of it now making you depressed and not in a good space and being anxious? So I think that that is something that you need to navigate. If you're feeling more worse and sad, then if you're not able to bring yourself out of it, rather, then
Mhm.
that's a problem. And maybe taking a break from social media, because there's a lot happening in our world right now that's really difficult. And you don't need to consume all of it. Find another way to be informed through the news, or maybe every taking breaks like once a week, or maybe 3 times a week. I'll just check in and be informed and learn the news, but I don't need to be on it for most of the day.
Yeah, that's true.
But the good part of social media, which is what you and I were talking about, is that it can serve as a form of connection,
Mhm.
and community, where you're meeting other people that are like you or share interests like you. And that can be really helpful,
Mhm.
especially like you're saying, like if you come to this country and you don't know other people, or,
Yeah,
you're like, oh, you came 6 years ago and I came here. There's so many stories, and even for me, like Facebook groups
yeah,
or hangout groups, and it's like you meet them online virtually and then they become in real life friends,
yeah, that's true.
but you meet them because of something, either your identity, either your interests. And then this is a whole new source, unlike, our parents' generation where you had to meet in real life. Now it's like, oh, and you live down the street from me and I never knew.
Never
So,
knew.
and yeah, and that way it can be very good. And you can have events that are going on. You can yourself make and organize an event for people too, where you're building your own community wherever you're at. So that's the benefit, I
Yeah,
think.
that's true. Yeah. So, like, what kind of tips you will suggest to have have a balanced life, health wise, like mental health wise and
Yeah.
physical health wise, like people should follow, just to
Yeah.
stay away from depression and anxiety.
Well, sometimes you can't stay away from it. Sometimes, you do have, if it runs in your family or you're having a lot of stressors right now, sometimes, like, or if you have a diagnosis of, depression or anxiety, sometimes you can't stay away from it, but it's how you cope with it, you
Mhm.
know? Um, but the, I would say to help, it is getting treatment, getting the support you need. Don't think that you're alone with it. Reach out, like, reach out to a mental health professional, reach out to your friends, even if you don't feel like it. Don't isolate. Get up and try to do things you enjoy, go for a walk, do something different. And sometimes those thoughts, when you're depressed, are going to change. Sometimes when you're anxious, it's going to change. And if you're in that space, like if you're depressed and you find that it's affecting you when you're eating, you're not sleeping, or you're sleeping too much, those are big indicators that you should kind of pay attention to and say, I don't feel like I want to reach out to anybody, but I should, because now this is overtaking me and I can't function. But I think a big thing is what you're saying is also balance, right? Having that social interaction, eating well, being healthy, taking care of your, and self-care right now is so important. We're still in, you know, and for us, our
Yeah.
families are in India, so it is, how are you taking care and nourishing yourself and giving yourself what you need, even if it is 5 minutes a day sitting outside or going for a walk or playing with your dog or just talking to your mother, if that's a good experience for you.
Yeah.
But remind yourself, even though you're working hard, even though life is busy, take a break for yourself, because if you don't, then you are going to start getting depressed and overwhelmed and overworked. You can only go for so long.
Yeah. So as we are talking about depression and like tomorrow is Mother's Day,
Yeah,
so like I know like a lot of heard about postpartum depression
yeah,
after I came here. But do you
yeah,
think in South Asian culture we recognized postpartum depression? Because I never heard that
yeah.
when I was in India.
Well, so they do talk about it in India, but again, there's a lot of stigma around mental health. So you might, in our mainstream circles and our friends, we're not talking about it, but so many people experience it. And, I've treated a number of women of color and South Asian women that have had postpartum depression or some symptoms of it. And it happens. We might not talk about it. We might not address it. We might not call it that. You might call it something different, but it exists. But I think that's part of it, to talk about it. A lot of women, what are the changes after you have a child? Sometimes it is, I have these thoughts, I have these feelings, I do feel sad, or maybe I even have psychotic symptoms around it, And I think it's to normalize it and to also get help when you're feeling sad, because you can only pull yourself out of it so much. Sometimes you do need help.
Mhm.
So, I think part of it, some of the reason that you haven't heard about it is the stigma, but also we might call it different. We might say, oh, she's very tired, or
Yeah.
and she might be tired, but also there might be more than that. And
Mhm.
getting support, because as we know, according to the research, a number of women, if they don't get help, can commit suicide, or that depression can last for a very long time and cause problems.
Yeah.
So I think it's relevant to talk about, because sometimes when we go through it ourselves, we don't know what's happening. We might not call it depression, but it's like, why am I having these thoughts? Why am I having this sadness or anger even? So
Mhm.
I think it's good to, when we start talking about it, you can say, oh, that's what's happening. And this is what can help you.
Yeah. So, like, do you think if family or like the older ladies who have
Mm-hmm.
experience, if they explain this to be a mom, right, before that,
Mm-hmm.
this kind of feelings you might have would help
Yeah.
better?
It could. Or even when you're having it, to reach out to your friends and it not being scary or judgmental, you
Hmm.
know, or it's like, oh, I had these symptoms too. And, I talked to this person who gave me these things to do when I feel sad. What should I do? How should I change my thoughts? How can I cope so those feelings don't overtake me, you
Hmm.
know? So I think part of it is reaching out to family, talking about it within families and community, you
Yeah.
know, and like we're talking about social media, maybe going and seeing what resources and communities are online for other women that are having postpartum depression, or looking for mental health providers that specialize in postpartum depression.
Yeah. So, besides depression and anxiety, what are other mental issues you have seen?
Oh, so many.
Yeah, yeah,
um,
because like people talk about depression more, so this get into everyone's
yeah.
head. But yeah, I would like to know about other things as well.
Well, there's so many. I think people are used to depression and anxiety, but there are also other disorders. And even when we say depression and anxiety, there's so many things within that. You can have major depressive disorder. You could have premenstrual depressive disorder, which means that you're sad the week before your period, and that's it. So there's different things within that. Or anxiety. You could have generalized anxiety, meaning, you have social anxiety, you have fearfulness going into to social situations with other people or speaking, or you could be scared of driving, or, you could just have general anxiety where you're fidgeting or you're having obsessive compulsive thoughts. So even within that depression and anxiety, there's so much. But, what I've worked with and some of my specialties are also psychotic disorders. So schizophrenia, or, people that have psychotic symptoms, maybe hallucinating or, having auditory or visual, hallucinations, but maybe delusions. Maybe their thinking is a little bit different or distorted. And so how do you help them kind of negate that and think properly or more rationally and help them recognize it when it's happening? Also ADHD, attentional disorders. I work with that a lot. Um, Pain, how to manage pain, how to manage the adjustment to medical disorders, like if you have cancer, if you have any kind of terminal disease, if you have a disability. Um, a lot of my work is also adjustment, like how we're talking about when you come and you move to this
Yeah.
country, you can have anxiety, you can have depression. It might not last for a long time, but
Mhm.
within that period, it can be called an adjustment disorder. Or if you have an operation and you're having, you can't move, right? You're in recovery and you're
Yeah.
feeling really depressed. That can be adjustment as well. A lot of things, as we're talking about COVID
Mhm.
in India and here, a lot of loss, when people die, a lot of my work has also been grief. When your parents start to pass away or your grandparents, or even during this pandemic, how do you navigate that loss? How do you make meaning of it? And how do you accept it?
Mhm.
Um, so there's a whole host of different things. Another interesting thing, that I see every so often, in addition to anxiety, psychotic disorders, attentional disorders, there's also autism, so developmental disorders as
Mhm.
well, like
Yeah.
autism or PDD, things like that. We also have our own culture bound psychological disorders,
Yeah.
like in India, like it might be based in our culture, like, oh, if we don't do something, if we don't do a specific religious ceremony, or we have some kind of symptoms, our culture already has a name for that. And we already have a treatment, and be something culturally bound too.
Yeah.
You get the priest to do a prayer, or you take this Ayurvedic kind of treatment,
Yeah.
So, but when you're here, it might look differently, and it might not overlap with a Western disorder.
Yeah.
But then that, remember when we were talking about policy, then it comes into training, right? If this isn't if these symptoms aren't matching up, what else could it be? And so the provider should, if it's something that's common, they can see, is this a culture bound syndrome isolated to this person? And can I treat it with treatment according to their worldview? What is the belief system of this individual, and how can I help them? And sometimes they need to work together with somebody indigenous or somebody from the community to really have effective care. So that's also something that should be considered.
Yeah, that's true. So,
Because in India we have so many different things that we might not see in the West, but when
yeah.
we come over, it's here,
Yeah,
and
that's
we have trouble
true.
with it.
Yeah, and even especially now people are focusing on Ayurveda.
Mm-hmm.
So you see that change here as well.
Mm-hmm. Mm-hmm. And that's the thing. As you and I are here, our community is diverse. There's not one way to treat a person.
Yeah.
There's several ways, and it depends on our identity. It depends on what's meaningful for us. So when I have clients that are very religious or very spiritual, I integrate that. And if I don't know, I work with somebody from the community, and we work together to help this person. Or we bring in the family,
Yeah,
and we work together, So it is a supportive system.
that's true. Especially like when you are living with your family is
Mm-hmm.
really important, so that you
Mm-hmm.
can talk to them and share your thoughts and
Mm-hmm.
feel normal.
And also maybe address issues, like if you're South Asian and you live with your mother-in-law or you live with your in-laws, there are other issues that might be different when you're here in the States.
Yeah.
So how do you address all of that together in a way that, you can find peace?
Yeah, that's true. So I have a last question. I won't
Yeah,
hold you long. So as we were talking about pandemic, right? So
yeah.
what type of common mental issues you have seen during the pandemic?
So it varies. It really depends on the experience of the individual. So I have a number of clients. I think all of us, life has changed for all of us in some way,
Yeah.
you know. So there have been elevated incidences of anxiety, depressive symptoms. For a lot of my clients, they were single and they were just isolated by themselves in their apartment, and that can be really difficult. For a number of us, like being South Asian, a lot of adult children moved in back at home with their with their parents and having to go through that dynamic again and having family conflict. Especially if their views are different from their parents or expectations are different. So that's been really hard, those intergenerational conflicts. But also, given that it is a pandemic, a lot of people dealing with loss
Yeah.
and bereavement and grief. And just to share personally, my dad, I worked in the hospital. So a lot of it was also, well, I also dealt with a lot of people that had COVID or were getting COVID. So that can be really difficult in terms of the anxiety and going through it. But for me personally, my dad went to the hospital and caught COVID while he was in the hospital and passed away. So some of us have experienced loss. Some of us know other people, and how do we support our friends when we can't meet them, right? And even some of the trauma around it also is that when you have somebody die, we couldn't do it in the same way. Like we couldn't have the pujas, we couldn't have the rites done.
Yeah.
And that can be really difficult. And how do we help the family navigate through that? But, I think it's a whole host of isolation, anxiety, how bad it has it gotten. And also, one of the biggest things for a lot of people is that so much a part of how we cope was changed. You couldn't meet friends, you couldn't go to the gym, you couldn't go out. And you also didn't know what was going to happen. So there was fear as well.
Yeah.
So now, depending on where you're at, life is changing and you're getting back to normal in a way, but you've had to readjust. You've had to find things that have had to work for you, or you're having an increase in symptoms. Um, what's also interesting, given your question, is that what I'm seeing now is people, since we've been so isolated for so long and we've gotten used to this change,
Mhm.
people don't know how it is to get back in the world again. They're like, oh, I haven't talked to my friends for a year and a half. How is it going to be? Or
Yeah.
there's still fear where I don't want to go out and do all of these things because there's still a risk involved.
Yeah.
So it is kind of knowing, what do you feel safe doing? What do you feel comfortable doing? And motivating them. Okay, just when you start getting out, it'll still be okay. You can still feel comfortable and it might go well, but alleviating some of that anxiety around it.
Yeah, that's true. Yeah, and sorry about your loss.
No, thank you. Thank you.
So, is there anything you would like to say, or tips or anything to our viewers?
Um, I think, I think maybe just to leave is, you know, don't be scared if you're going through something. If it's postpartum depression, if you're feeling differently after, like you were mentioning, after giving birth, there's so many different emotions. But if you're feeling like you're in distress and not able to do things, that's a sign of getting help. If this pandemic has been really hard and you don't know how to get back into life again, or you're having issues with your family, there are resources there. There are people that you're not going through it alone. you know Sometimes the first step is just to reach out and see what's out there, so don't
Mhm.
be scared.
Yeah, thank you. Thank you so much, Dr. Devika, for having a wonderful discussion on mental health.
Yeah, and if anybody has any other questions, or you want to do something even more specific, just let me know. This is my area of expertise. It's my passion, so I can talk about this for so long, and I enjoy, I want to also thank you for hosting this, because I know that just bringing this information out there to so many people makes a difference and helps us connect with each other. So I wanted to thank you as well.
Yeah, thank you so much.
Mhm.
Have a wonderful day.
You